Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question about chin and jawline fillers. What are 7 key things that you need to know in order to get the best results and avoid risks and complications? So, when looking at this, the things that we need to think about are, first of all, what are chin, what are jawline fillers? What is the importance of them in terms of this area of the face? Am I a good candidate for it? Well, I'll draw up some pictures of some of my patients and give you an idea of who's going to benefit and who may not benefit. What are the options when it comes to fillers in this area? Let's look at some cases with before and after photos. What is the recovery? What is the duration? And of course, what are the potential downsides? What are the potential risks and complications from this treatment? I'm then going to give you some of my own personal tips from my experience, and I will also talk to you about the cost of this treatment. So first of all, an introduction from myself. Well, I'm based in London. I'm an oculofacial plastic surgeon, and I only complete treatments on the face, and I perform both non-surgical treatments such as fillers and surgical treatments. And these treatments are treatments that I do every day for my patients. Now, as a medical disclaimer, well, none of the information contained in this is really for a personal consultation use. It really is for your own information to help guide you and be entertained. So first of all, what are chin and jawline fillers, and are they important? Well, really the chin and the jawline is one of the areas of the face that really symbolizes youth, and it is something that where definition and a distinction between the jawline and the neck and relative proportions of the chin to the rest of the face really add to an attractive face. Angelina Jolie is a good example of a beautiful woman, and I previously have done a lot of analysis of her face using the golden ratio, measuring various proportions of her face, and really one of the most identifiable things about her face is the angle of her jawline, the definition of her chin and neck, and really that adds to her all-round beauty. And we can correlate that information by taking various measurements and using that against the golden ratio to really give a score of beauty. Now, with aging, the jawline changes and some of the volume of the face tends to drop downwards with gravity, and that tends to give a more tired and aged look. And in medical jargon, that's often called jowls. And lifting this area often augments the face and gives you a more youthful appearance. In men, well, the chin and the jawline is also of much significance because the chin and the jawline often correlates with a handsome looking face. And a good example of this is Brad Pitt. His jawline, actually when I measure it against the golden ratio, is actually above average limit, which really amplifies how important the jawline is in this area. You know, he has an angled jawline, a very defined squarish chin, and that is very much a masculine quality. So there's definitely a difference between men and women. An attractive male chin and jawline tends to be squarer, whereas a more female jawline tends to be more V-shaped or heart-shaped, and those characteristics, although not uniform, generally can be helped with fillers in order to create a more attractive appearance. So what are chin and jawline fillers? Well, most fillers used today, over 90%, are made out of hyaluronic acid. So sometimes they're called HA fillers. And these are a gel-like substance. Now there are other fillers as well. There's calcium-based fillers and there's other fillers like Sculptra, but predominantly fillers are HA fillers. And these fillers, well, in a way, they're made out of a clear gel. And although there are different types, they all have some similar properties in that they tend to be clear, they tend to be able to be injected, and they all have an antidote, which means that an enzyme, hyalase, can be injected that will dissolve this filler to water, which has been a major innovation in non-surgical treatments. Having said that, different HA fillers have different properties. Some repel water and some soak up water like a sponge, which means they tend to inflate with time. Now, these fillers exist naturally in the skin and in joints, and so actually reactions and allergies have become very rare, and so they have really become the gold standard in like non-surgical treatments. Am I a good candidate? Well, if we first look at the chin area, now if you have a recessed chin, what does this actually mean? Well, if we were to look at this side profile of this person, ideally, if you draw a vertical line through the lower lip, in a perfect world, your chin should be within 2 or 3 millimeters of that line. Now you can see in this after photo here, well, the chin really slopes backwards and there's not really definition of a chin. Now, if you have a smaller chin, well, not only does it tend to disproportionate the face, it tends to make your nose look a bit longer because the relative proportions of your face are affected. And sometimes it can give you more fullness in the neck because having a smaller chin concertinas everything behind that area. Whereas if you have a longer, more projected chin, that area is more stretched. So it can affect the neck area as well. How about the jawline? Do you need more definition on the jawline? Well, this patient came to see me and she's a beautiful woman with a good symmetry of her face and well proportioned, but she lacks some definition along the jawline. And so really it's a personal preference, and using fillers, well, I could really define this jawline in a way that gives her more definition and more facial balance, and so it's a personal preference to accentuate the jawline. Surgery versus non-surgical options. Well, this kind of chin and this kind of jawline, we can see that the chin sits quite a long way behind that lower lip, and this fullness in the neck where the chin is starting, well, the neck is starting almost where the chin is, this is less youthful and less defined, and it reduces some of the attractive qualities of the neck and jawline. It'd be very difficult to treat this patient with a non-surgical treatment alone. And this patient I actually treated with surgery, and I did a chin implant with liposuction and radiofrequency to tighten the skin, and this gave a really good result. To try and treat this non-surgically would be quite challenging. Having said that, chin implant is a relatively modest surgery where it takes about an hour and the recovery tends to be like a week. And so there are other more extensive surgeries like genoplasty, orthognathic surgery, and these are a different level in terms of recovery, in terms of the potential issues. And so it really depends on exactly what you need, what's going to give you the best results. If you had a very recessed chin and when you close your teeth, the teeth don't align, you have like a cross bite and the teeth are just like not meeting in the right place, well, sometimes orthognathic treatment will be the best treatment. However, that is a different level of surgery because the whole jaw needs to be moved and brought forward. So how about taking this as an example? So this gentleman, he had like a flatter chin, his chin is several millimeters behind the jawline. He could be treated either non-surgically or surgically. Some patients prefer to have a non-surgical treatment. This gentleman preferred to have surgery, and so I completed a chin implant surgery for him, and afterwards he had a well-proportioned chin that was more projected, improved jawline and neck angle, and he was like really happy with that. What are the cases for using filler? Well, this is one example where this lady similarly, she had a flatter chin, mild projection of the chin. Afterwards, well, she just had more shape to the chin, it was more projected, it looks smooth, even, natural, and I injected a hyaluronic acid filler here, which will last for about a year. Now, the advantages of using, say, filler over surgical means or other means, well, you can add projection, you can make the chin more protruding, you can add length to the chin. If the chin is short, you can lengthen it downwards. You can add width, you can make the chin squarer, and a bit like an artist, you can really sculpt filler along the chin and the jawline. So you can add more to one or less sides, which can reduce asymmetry. And for some patients, it can be combined with Botox to reduce dimpling. chin fillers in a way are more flexible than other means of such as surgery, because if you had asymmetry and there was less volume on one side compared to the other, well, you can add more filler to the smaller side and improve that symmetry to an extent. I mean, in a way, we're adding volume, but we can't change the underlying bone. Why have chin fillers become so popular? Well, they're fast to do, takes less than 30 minutes, and you see an instantaneous result. There's relatively minimal recovery, and patients may have some swelling for a few days. There's a small chance of bruising, less than 5%. It's a little bit uncomfortable, but generally very well tolerated. Ice, cold compress, topical anesthesia, well, these can be used to make it even more comfortable. And of course, it's a lower cost than undergoing a surgical procedure short term. Long term, those costs will of course add up. How about jawline filler? Well, in this lady, we can see, you can't really see where the definition of her jawline, her mandible is related to her neck. Well, afterwards, and this was actually literally 5 minutes after the procedure, you can see she's got more definition here. There's a shadowing beneath the jawline, and it just has a more attractive quality to it. This is another patient, and this patient had some degree of facial aging. And with facial aging, the effective gravity means some of the volume of the midface comes downwards, and you start to see a jowl along the jawline. Now, using fillers, well, I was able to restore her jawline, lift the jawline, and you can see it also improves some of the platysma and loose skin in the neck area by adding volume. Now, this can be done to an extent. However, as I mentioned to you earlier, a more youthful jawline tends to be more V-shaped. Now, if a lot of filler is added along the jawline, it starts to look square, which means it doesn't necessarily look better. And so adding filler along the jawline, it can be used very effectively, but it needs to be done with caution. Otherwise, too much volume makes the jawline too square. What is the recovery? Well, generally there can be some swelling. There's a small chance of bruising. I advise patients that they may have swelling for a few days, maximum really 5 days. If you did have bruising, most also will go within 5 days. Key is an understanding and appreciation of expectations, because we're not able to change the underlying bone, and we can only modify things with the addition of fillers. To be super cautious, it's a good idea to avoid things that will thin the blood before any treatment such as fillers, and this includes herbal medicines such as fish oils, using medicines like aspirins and non-steroidal anti-inflammatories. Ice immediately after the procedure for 10 minutes can also help reduce bruising, and generally it's a good idea to avoid exercise or a lot of activity for 24 hours. And what about the results? Well, the results, generally they will last for 12, sometimes 18 months. And how long exactly? Well, it depends on your own metabolism. And there are more fillers that are being manufactured that last for longer periods of time, but we should be mindful of that the best fillers are hyaluronic acid fillers, and these fillers really, they dissolve over a period into water. And even the best fillers at this moment in time that have all the necessary regulation and FDA approval, well, generally they will last for 12 to 18 months. What are the risks? Well, the main risks come down to the aesthetic appearance. Too much filler creates too wide appearance that reduces some of the attractiveness of the jawline and the neck. Too much volume can also result in drooping of the chin, and so there's a limitation of how much filler can be added to this area. And if it starts to droop, well, it can sometimes give an appearance even as a witch's chin. And a little bit of filler can be a good thing. Too much, well, it might need to be dissolved, and then it goes all the way back to where you started. Now, although the most frequent issues are going to be aesthetic, unfortunately there have been some more serious issues, skin necrosis, where some of the fillers being injected into a blood vessel in this area that ultimately can result in scarring and damage to the skin. And of course, there's also a small chance of infection with injection of fillers. So there needs to be meticulous cleaning of the skin by the doctor or aesthetician doing these treatments prior to filler injection. Well, what about the cost of these treatments? Because the cost can certainly vary significantly from a few £100s to even several £1,000s, depending on how much filler and where the filler is done. And the criteria that's going to guide this is partly the experience of your doctor, your surgeon doing the treatments. Currently in the UK, as in many countries, there's a lack of regulation in this area, and so you don't currently need to be a doctor or have any specific knowledge of the anatomy to do some of these treatments. And of course, these can carry a certain degree of risk. And depending on the experience of the clinician, the cost will vary. Some treatments are done in a regulated environment, and of course those are going to be the safest. In the UK, that's the CQC, but something that is done outside a regulated or healthcare establishment may not have that CQC protection. Anesthetic, well, it can be done without anesthetic. Most fillers have a degree of local in them. I personally use a mixture of topical anesthetic, ice. Local anesthetic can also be injected in that area, but often more anesthetic is not required for this area. How much volume is required? Well, some patients might require just one vial. Some patients may require 3 or more vials of filler, and that's obviously going to make a difference to what the cost is. Different products can have different costs, and currently there's been an influx in the UK of some fillers that are lacking the necessary regulations, and some of those fillers, well, potentially they're going to have other side effects and downsides, and so it's best to have treatment with the best products that all have the FDA approval and full licensing for use in this environment. And in terms of technique, well, different techniques can be used in order to provide this area a filler. And I personally, depending on what the patient needs, can combine 2 different fillers. Sometimes a hyaluronic acid filler with a calcium filler to give more definition along the jawline and the chin. And that's particularly helpful in certain patients because it will simulate bone. However, that takes more time because the fillers have to be made up and mixed, and so it requires more effort to give those patients that result. So, a few of my own personal tips. Well, firstly, in terms of practitioner, it's really helpful for you to see someone who's experienced in this area, who understands the anatomy, and there's definitely a degree of artistry in this area. And so you really want to see an expert who has these kind of experiences and criteria to get the best results. In terms of fillers, well, I definitely think hyaluronic acid fillers are the safest fillers to use because they can also be dissolved. However, from my experience, adding calcium can certainly give more definition in some patients. Avoid permanent fillers because that can be a serious issue and can be very difficult to undo. And unfortunately, there's more patients presenting to my clinic who have long-term filler issues, which can be quite difficult to rectify. And some of these patients require surgery to actually remove the filler. In terms of cost, well, cost of course is important, but the result, I would say, is also of great importance. And there's never going to be, you're never going to have the best results at the cheapest cost. And so it's finding that balance between improving things, but looking after this aspect. In terms of limitations, well, if you have more loose skin, fillers are not going to be ideal because they can't take up that loose skin without adding a lot of volume. And a lot of volume in the chin and jawline does not necessarily look better. In addition, if you have a fuller neck and there's more soft tissues in the neck, well, sometimes you are just going to get a better result if some of those soft tissues are reduced. And the limitation of filler is you just cannot add any more volume there. And sometimes you need to take things away, and that's really where surgery can benefit those patients. A more V-shaped jawline generally looks more attractive, and so just be wary of adding too much filler on the jawline because it doesn't necessarily look more youthful. And there are of course newer non-surgical treatments that are becoming more available, such as radiofrequency, But be a little careful with radiofrequency because that can dissolve some of the fillers that have already been put in. So, in summary, the chin and the jawline fillers, well, we've talked about why are they important, what are their benefits, what actually makes up the filler. We looked at what will make a good candidate and what will make potentially a more surgical candidate. We looked at some cases before and after. We talked about the recovery. We talked about the potential risks and complications from these treatments. I gave you an idea of the costs and what can influence that. And of course, my tips. If you have any further thoughts or questions, please do not hesitate to get in touch. And if you'd like me to answer any questions on any specific topics, please let me know. I hope this has been interesting for you. Thank you for watching.